Morning, everyone. Welcome to our the current installment in our e-seminar series on COVID-19. Um, excuse me, and apologies for the slight delay in connecting. I was fumbling with my WebEx. I didn't have a better excuse than that. It's a pleasure to welcome you to this e-seminar, the topic of which today is labor mobility, migration, and COVID-19. It's a great pleasure to have two distinguished speakers. Our first speaker is Mushfiq Mobarak from Yale University, who will talk about responding to COVID-19 in developing countries. And then we'll be followed by our own Erhan Artuc in the Development Research Group in DEC, who will speak about labor mobility in pandemics. We have 1 hour together today, and so what I thought we could do is begin with 20-minute presentations or so from each of the speakers back to back, and then we'll open up for questions. You can send questions through the chat function in WebEx if you're connected that way, and you can also send questions or let me know that you would like to come in. Sorry, if you're on WebEx, you can come in with your questions and let me know through the chat function. And if you're watching on YouTube, you can come in with questions through the YouTube chat. Without further ado, let me turn over to welcome Mushfiq, and you're the first speaker. You have about 20 minutes. And you're on mute.
Okay. Thanks very much, Art, and thank you for having me. So I'll do just two things today in my 20 minutes. So one is to give you an overview of sort of COVID response work we're doing in collaboration with the Bangladesh government and other important implementation actors in Bangladesh like BRAC. And I'll touch briefly upon the collaboration with the World Bank on trying to design a new social protection system. But then what I'd like to focus most of my time on, given the nature of this particular audience, is some between mobility migration and this COVID-19 crisis. It turns out that migrant households are, I think, uniquely at risk here, and I'd like to share some insights that are coming out of our data on the ways in which migrant households are experiencing this crisis differently than non-migrant households. So let me start with a broader overview of what we are doing, because that will help you understand the data sources that we'll then use to talk about migration during COVID. So when we started thinking about, so by we I mean YRI, the Yale Research Initiative on Innovation and Scale, which is a collection of researchers around the world, and we have staff in New Haven. And when we started thinking about the COVID crisis, and especially Bangladesh, which is where I'm from, and I've been doing a lot of work there. So an early insight was that, look, Bangladesh, like probably many other low and middle income countries, will not have the luxury of a lot of testing data to make evidence-based policy decisions on the basis of good epidemiological information. Right? So then we were trying to figure out, okay, how can we plug in that gap? And the idea is that we had been running a bunch of surveys for unrelated purposes, nothing to do with COVID, for the last few years. So we had access to representative samples of households, and we also had good baseline information on them. And so we immediately started conducting 3 weeks ago high-frequency data collections through phone surveys to a number of different samples. And those samples include, say, representative samples, includes samples of migrants, it includes samples of refugees, Rohingya refugees, as well as host communities living near those refugee camps. Okay? And so we've been asking them about symptom prevalence. So this is in collaboration with doctors and public health professionals on, like even in New Haven, about 4 weeks ago when we didn't have enough testing, the Yale Institute of Global Health had developed kind of an algorithm on positive COVID symptoms and negative symptoms. Like nasal congestion, that's actually good news, right? And so we basically implemented that symptom module. We also asked people about public health behavior, their knowledge, and then of course, this is going to turn into an economic crisis. And so we asked a lot about income shocks, food insecurity, and what's happening to remittance income for the sample of migrants, as well as returnee presence in their community, because we know that this virus travels via person-to-person transmission, and so migration is an important vector of spread. Okay? And so while we were doing these phone calls, right, it also made sense for us to use existing research, body of research, to try out strategies that might help spread good information. So in this case, we have a couple of social influence strategies that we are experimenting with, and quickly experimenting with, getting feedback in a week or two, and then working with the government to see what should be scaled up. So the two types of influence. So one is based on personal appeal. So basically, we know from existing research, and some of it actually done with the World Bank in the past, on how do we spread new agricultural technologies and information about new techniques. Turns out that when people hear it from their friends and neighbors via social learning, that's often more effective than sending it out by, say, extension agents. And so we're basically applying those strategies here. So sending out good information to counter hysteria and stigma, etc., via social networks. Okay? And then the other important issue we face in Bangladesh, as in Pakistan, Nigeria, Indonesia, etc., is that people are still going to the mosque, and then with Ramadan coming, which is here now, it would be even more dangerous when people congregate at mosques, and that's a great way for the virus to spread. And so we worked with Islamic scholars, the Imam Training Academy in Dhaka, right, to develop a script by which we would contact imams at local mosques, because unless these village imams really endorse the message and enforce and help implement, it's really difficult for us to get people in remote corners of the country to listen to any kind of central government directives. Right? And the government itself has now made an about turn in that directive. And other than imams, we're also working through school headmasters, so basically other people whose opinions are respected. So we're sending out a bunch of sort of social influence also via phones to maintain physical distance. And other than that, I'll talk a little bit today about, collecting migration data from various sources. So airport returnee data from the disembarkation cards, collecting data on migration permits that have been handed out in the last 10 years, and in order to make inferences about where the likely hotspots would emerge, where we need to pay more attention. I'll show you some maps. And the idea is that taking all of this data and basically doing some combined economics epidemiology modeling, right? And the reason to put the data together this way is that, all of the models that have been influential in the US, UK, et cetera, like the Imperial College model, right? That's primarily an epidemiological model focusing on the behavior of the virus and the spread of the virus, right? But especially in low and middle income countries, when we want to evaluate policy, it is vitally important for us to add some behavior, human behavior, into those models. The reason is that, so for example, if you have, say, social distancing guidelines, if compliance is imperfect, right, that will change your predictions on the effectiveness of such policies, right? And so we have to have that kind of behavior. People's knowledge will change your predictions. So we want to add things like that to the model. We want to add human mobility to the model, and also economics, because by economics I mean that the costs here are not only in terms of deaths due to COVID, but the costs may also show up in terms of malnutrition, in terms of hunger, in terms of changes in visiting healthcare facilities for other reasons, and so forth. Right. So we're trying to put all of this data together to inform more comprehensive models. And then finally, if I won't have time to get into this in detail today, but one of the things we realize is that regardless of what social distancing policy you're comfortable with, it is imperative that we get money in the hands of poor people very quickly, because they're suffering, right? And if they're going hungry, then they're not going to abide by your distancing guidelines anyway, right? And so now you have a problem in countries like Bangladesh and Nigeria, where you don't have the existing infrastructure where you can easily identify who is poor, who is deserving of support, right? How do you actually go and target them? So here we are using a variety of strategies. So the one main one that we're working on in collaboration with the major telecom service providers as well as the government in Bangladesh, is to look at, so because we have all this survey data, we have some ground truth for a sample of, say, up to 15,000 households, like who's poor, who's deserving of support, and based on these phone surveys, who is hurting the most right now, who are the new poor, right? So now that we have the ground truth, if you merge in the cell phone data on top of the survey data, right, then you can start inferring subtle patterns of cell phone usage that differ among the poor and the non-poor. Right? And if you let a machine learning model loose on that information, and it develops, it deciphers those patterns. And if you feel confident that you have a model that's predicting the poor and helping you distinguish the poor and the people who are hurting right now from the ones who are not, or hurting more from the ones who are hurting less, then that would be a really quick way for us to then take that machine learning model, give it back to the telecom service providers, and have them run it on their entire subscriber base of like 100 million or more people, right? And that is a quick and dirty way to identify the poor. And of course, you're going to make inclusion errors, you're going to make exclusion errors, and we are trying to devise a system where there's a human element brought back in, right? Where if the model identifies, say, high or medium likelihood of poor, we send out SMS and ask them a few more questions in order to devise a benefit targeting system cost effectively. So we've started this in Bangladesh on the basis of pre-existing conceptual work in our team, done in Rwanda and in Afghanistan. And then we are in partnership with the World Bank. We're in discussions on how to implement such a system in Nigeria right now. So I'm happy to connect on all of these. So I'm just giving you a broad overview, and I'll we can connect by email. Okay, now let me just talk a little bit about migration. Yeah. And those are I'll give you two sets of detailed results, and then I'll also. So the summary here, before I get into the details, is that households, there's some households that are, of course, very remittance dependent, and many such households in South Asia, in Nepal, Bangladesh, places where we're collecting data. And what we observe is that these migrant sending households who are remittance dependent have experienced really sharp declines in their income, even relative to other poorer households that did not have migrants. Okay? And then so that's the economic connection with migration. And the thing that's very clear in the is that returnees, migration return, is strongly associated with COVID symptoms that we document in our data, right? So these guys are also now facing a lot of stigma as a result of this. And then we need to start doing this. We haven't yet been able to document stigma systematically, but that's something that we have a plan to do. Okay? So the implications here are that, the World Bank itself has issued a report that where you estimate 22% drop in remittances in South Asia. In Bangladesh, observed a year-on-year drop of about 25% already. And these are the households that are remittance dependent, or areas that are remittance dependent, that are worst hit by the pandemic, and we need to ensure that that those are the households that receive some form of protection now. Okay, so the samples, I'm gonna give you a quick fire set of results. The samples come from a work done in partnership with Ifat Sharif and Mahesh Shrestha at the World Bank, which is a government-to-government visa lottery program. So Malaysia took some Bangladeshi migrants, and the visas were allocated by lottery, right? So we have good identification on who was a migrant household or not. And then a panel survey of refugee households, Rohingya refugee households, as well as host community members surrounding those refugee camps, Rohingya refugee camps. This was also done in partnership with a different team at the World Bank. And then some work that we are doing on seasonal migration and seasonal poverty in Nepal, and this is in western Nepal, both in the hills and in the terrain. Okay? And so here's some basic facts. So one is that this is from the refugee camps, right? There's been a huge drop among refugees and among host communities, huge drops in income. So I'll just point out one fact. So in 2019, when we last talked to them before COVID, 74% of men in Bengalis who were in areas surrounding refugee camps were employed, but that has now dropped to 22%. So there's a huge drop in employment. That's true for the refugees as well. Okay. A second fact is that remittance income has declined for migrant sending households. So this is data we just collected after the lockdown in April in Nepal. So this is what remittances look like in this sample that we have been following around month by month. Okay. So this is the variation in remittances. It is seasonal, and here is the situation post-lockdown. And why has this dropped? One reason is that many migrants were forced to return, right? So this is, migration is seasonal here. People go to India, people go to cities in Nepal. So you see, this is the very seasonal variation migration. People are out away before the harvest during the lean period of the agricultural season, pre-harvest. They come back during the harvest and for the festival, right? So this is how migration varies, and this is what the migration rate is after the lockdown. Right? So one is that people have been forced to return from India and Nepal, and the second one is that even the set of people who are away. So this is what over time the remittances per adult male away looks like, right? It doesn't vary all that much. How much money people send, close to 4,000 rupees, okay? And this is what it looks like now. So even the people who are away are sending a lot less money back, okay? And then now the sample of international migrants. And here, this is the Bangladesh Malaysia visa lottery program I had alluded to, right? So it turns out that lottery winners. So I'll give you the bottom line number, which is that lottery winners were earning about 18% more in 2019 than lottery losers, and the lottery happened in 2013. And the reason they earn 18% more is that we observe in our data that they are much more likely to be international migrants and they have much higher remittance income. Okay? They had an 18% premium on non-lottery losers, and then right now in April 2020, when we surveyed them again, there's been a complete reversal where lottery winners are now 36% less likely, or have 36% less income than the lottery losers, right? In other words, migrant families or high likelihood migrant families have lower income now than low likelihood migrant families, and this is a reversal of the ranking. Okay? And you see that over 10% of lottery winners are saying they have no income whatsoever, but only 6% of lottery losers. Okay? And another fact that comes from the Rohingya areas, the Cox's Bazar district, Rohingyas and Bengalis, is that many people report symptoms and that's true for multiple samples. But most importantly, something that's not shown in the graph, but it's down here, is that if you're a person who is in a community that reports having a recent migrant returnee in the last 2 weeks, right, then your odds of reporting COVID symptoms, like WHO, CDC COVID symptoms, your odds basically triple relative to the set of people who don't have migrant returnees. So migration seems to be a really important vector that's already showing up in the data. Right? And you can imagine that this is going to lead to a lot of stigma as well. Right? Okay, so fine. Okay, so this is what I'll do with my remaining couple of minutes. So now that there's these strong links between migration and COVID symptoms, right? Can we actually use that to make some predictions and predictive policy prescriptions? Okay, so the idea here is I'm going to give you a very simple idea, and then I'll show you the maps that get produced on that basis. So since migration spreads, since the disease spreads by human to human transmission, right, the areas that are migrant sending are likely to be more at risk. Okay? So that means that I can actually, if I can link every sub-district in Bangladesh to Italy, Singapore, places where the disease emerged early, right, then I can create kind of a heat map that gives you a risk exposure index for every sub-district in Bangladesh. Okay? And so that's what we ended up doing, and these are the maps that get produced, and hopefully this was we've shared it with the government, and it gives you some sense of what are the areas where the disease is likely to be present, where you need to pay a bit more attention, and also these are the areas that are going to experience the sharpest drop in remittances. Okay? And so that's the outcome of our predictive model. How well does it do, right? So we can basically look at our prediction, which is in the x-axis, against some actual data, like quarantines, right? The fact that it matches with quarantines, it maybe is not such a surprise because the quarantine decision is partly dependent on, what we track in our data, which is, are there returnees, recent migrant returnees, okay? And because the government is also paying attention to that. But what's even more interesting is that the government hotline where you can make distress calls, and we've now gotten the data from the telecom service providers on exactly where the calls are coming from, and that matches really well with our sort of exposure index constructed on the basis of migration. And so basically what I'm saying is that we make some predictions and it gets validated by some actual data. That's true for Bangladesh. We use a lot of different data sources in Bangladesh. In Philippines, we tried it out as well. And you get a map at the municipality level. You could do it at the province level. And it also matches well with actual testing data that the government is reporting on a website. And importantly, I just want to say that in doing this work in Bangladesh, we used many different data sources. So we used the data on airport returnees, the disembarkation card data from the Civil Aviation Authority. We used data on migration permits handed out in the last 10 years from another government administrative records. And third, we even used HIES, the LSMS style survey that the Bangladesh Bureau of Statistics does, and even that actually has predictive power. And I mention this because if LSMS style surveys have predictive power, that means that you can do this exercise for many different countries. Okay. Okay, and then not only can you do this exercise subnationally, right? You can also validate by international case data because you can apply the same concept, which is let's look at the link of Senegal versus Egypt versus Niger versus Nigeria to international migration links to countries like Italy versus France versus Spain versus China or South Korea, right? And then that also creates a prediction at the national level, which is on the x-axis, and it gets validated pretty well with the actual cases and actual deaths. Right? This the second one should be deaths, and that allows you to construct these types of indices at the international level. Okay, so let me stop there. Happy to take questions.
Thanks very much, Mushfiq. This was a wonderful buffet of many different research topics. Thanks very much for running through them. We'll turn over now to Erhan Artuc, who will present joint work with Chalarosdan and Luang.
Hi, thank you very much. I'm going to present a joint work with Çağlar and Hı. The title is Labor Mobility and Geography of Pandemics. Mushfiq already gave a very good overview of why we need to combine epidemiology models with economic modeling, especially the migration model. So how migration models can explain the spread of the virus. So this is our attempt, a modeling attempt in this direction. So what I'm going to do is I'm going to give you a brief overview of the model and some intuition behind the modeling. And I'm going to show some simulation results. So the motivation first. The pandemics is the ultimate economic externality because it is spread by people who are least likely to be infected. Essentially, there are people who are showing no symptoms or very little symptoms, and they are spreading the virus especially to people who are the most vulnerable. And the epidemiology models are very good in capturing this. They can even incorporate mobility of people within the country or across countries or cities. However, they have a few shortcomings that are quite important for us as economists. First of all, they usually assume that mobility of people is exogenous, as just Mushfiq explained, why we have to consider that the mobility is endogenous. So this is a model where we can endogenize the mobility of people. And then the second point is that policy interventions will have spillovers. So a policy that you have in Bangladesh might have some spillovers to a neighborhood country if there is migration between, let's say, Bangladesh and India. So what we are trying to do is try to understand, and also the spillover is even larger in cities where people are traveling all the time. So we will try to understand how these spillovers work. And for this goal, we are going to combine an endogenous labor mobility model with the canonical SIR model. Okay. So what are the questions that we are interested in? First of all, we would like to understand how mobility spreads, the spread of outbreak. There are already some papers looking at this in the epidemiology literature. But what we want to add is to understand the opposite as well, how the outbreak affects endogenously the mobility of people across cities, like traveling, or could be migration. And then how different types of policies impact the spread of outbreak, labor mobility, and welfare. So we are going to be modeling these components, and how the policy responses affect each other across different cities, and you can actually generalize this to countries. There will be spillovers across cities and countries. And then why do we need to have a policy coordination? So we will show that you need coordination at the local level. So you need a federal coordination. So you cannot let the states perform their own policy. And also, this also clearly shows that you also need a policy coordination globally across countries for the same reason. I'd like to make just a few additional points, some of it which we already mentioned. So usually in these types of epidemiology models, you have two types of individuals: low-risk people who are usually young, showing mild or no symptoms, and they usually have no pre-existing conditions, and mobility of these people are actually accelerating the spread of the virus among high-risk people who can actually have severe symptoms, get hospitalized, and possibly die. Since the low-risk people show very little symptoms, they are not aware and they can travel while they are actually sick. The first externality is the externality caused by the young people or low-risk people to the high-risk people. And second, you can actually generalize this idea. So if low-risk people are spreading the virus to high-risk people, you can actually think of this as different cities spreading virus to each other. Some cities will be at the later stage of the outbreak. So that's what we are going to focus on. But you can think about it in different ways. It could be the case that the population proportion can be different. For example, in Turkey, the population is very young. So it's probably a lower risk country compared to, let's say, Switzerland, based on the population, based on the demographics. Okay, so this will create a second externality. And then we will try to understand the second externality. So to combine these components, we are going to bring some intuition from trade and migration literatures, but we won't be using the most standard or canonical models, which are usually assignment models like the EK model, because the problem with those models are they are static and they cannot really have dynamic components. So we will really need a dynamic model where we can apply some high frequency data and model the spread of virus through travel and mobility. So I'm just going to introduce the model. I'm going to show only one equation and try to explain the intuition using flowcharts mostly. So in our model, we first think about a simple example with 3 cities, and we are going to expand this to actual data, but not in this presentation, but in a future work. So imagine that you have 3 cities. So people might be moving across cities, traveling. So this is a travel model. It's not a migration model per se, because you want to make it high frequency. So they travel to city. Let's say that a person from city 1 can travel to city 3 and then come back. And when he or she travels, she has to pay the moving cost. Alternatively, she can stay home and produce at home, or she can go and interact with other businesses in her own city. Okay, so actually we need something a bit more sophisticated than a simple mobility model. So I'll try to explain how it has to be different. Imagine that there is an agent in city 1. So she can interact with different businesses, and the businesses can be located in different cities. So in this example, the agent visits a business in city 3, and she has to pay a moving cost. Why can't we just model migration or mobility using cities? Why we need to have these subcomponents, what we call businesses? Because we would like to be able to model how closing down businesses is affecting mobility and outcomes. So that's why we have to use businesses as a unit analysis rather than cities. So in the simulations, we are going to shrink the number of businesses in each city as a measure of shutdown. Second, she can produce at home or she can interact with a local business. So this is a discrete choice model where each agents choose a business to interact with. And then we combine it with the SRI model. So there are susceptible people. We consider two agent types so that we can model the externality across low risk and high risk people. And then we will assume that the number of the possibility of infection is a function of the number of infected people in a city visited by the agent. So if you go to a city where there are lots of sick people, you are more likely to get sick. Similarly, if there are so many visitors from outside in your own city who are sick, your likelihood of becoming sick is also higher. And then we assume that by staying home, you can significantly reduce the risk of infection, but you cannot make it zero. Because even if you stay home, you have to interact with, you have to do shopping or online shopping, and you have some interaction with the outside world. You cannot completely isolate yourself. And then, different from the standard SRI model, we have probability of death. So this is very important. Although we don't have a life cycle model where the agents face risk of death, we have a special case where people who are infected can die. So the reason why we have this addition is because the probability of dying might be a function of the congestion in the healthcare system. And also, while we were discussing this model among ourselves, we realized that this is really very similar to the problems that we face in the trade and inequality or migration and inequality literatures. So basically, this outcome is the ultimate inequality. So we can use the same tools, many of the tools that we have in migration and international trade literatures, but there are some very important shortcomings in these literatures. First of all, we don't really have any tools to quantify the inequality. So we cannot use really like something like Atkinson index or Gini index to quantify the inequality. And then usually what we discuss in trade and migration literature is reimbursement or compensation of the losers. Here, the diseases are gone, so there's no way to compensate them. So this is a very extreme and irreversible inequality. So just like that, we don't only show the aggregate output outcomes in the trade literature, we care about inequality. In this model, we have to report other outcomes, like the ratio of death, to show how the inequality works. And we don't take any stance about the welfare function of the social planner. So they will be caring about the number of deaths, but we don't want to put a number on the value of death. So we are just going to show some trade-offs between economic trade-offs and the health risks. So this is the only equation that I'm going to show you. This is the Bellman equation, but not the true Bellman equation. It is the Bellman equation with the expectation over the IID variable, so that it is much easier to explain. So here is the value function. VITH is the value of people with health status H and type S, that is high risk, low risk. I is the city and T is the time. And we have to sum this value over the cities plus the staying at home. And then the first component is instantaneous utility, omega term. And then we have probability of moving. So if you move to a city with high risk, with lots of infected people, you are more likely to get sick. And then our utility will be a function of the number of businesses, this term N. As the number of businesses expand and shrink, the economic outcomes will change. We have moving cost as it's the standard. And the most important function here is the pi function, which determines the probability of switching from health status H to H prime. So since it's a travel model, we could actually write it as a static model, like an assignment model, without using any dynamics. But here, the risk of infection creates dynamics in the system. So you want to avoid going to cities with high risk. And then it's also a function of your next period value. Okay. So just moving to simulations, I'll just skip this very quickly for the sake of time.
Erhan, speaking of time, about 5 minutes to wrap up?
5 minutes. Okay, so we have simulation parameters. So we have basically two simulations. One simulation is city isolation. We are going to study how different isolation scenarios affect the outcomes, and we are going to talk about social distancing scenarios very quickly. Okay, so the mobility before the pandemics. Here we have 3 cities and showing the ratio of people visiting each city. The purple part of the bar is showing the number of people who can stay home during the pandemic. And we calibrate it to be about 20%. And we have about 5% people in the first city. It is the yellow and orange bars visiting other cities. And then 70% of the people are interacting businesses with their own city. So this is the infection dynamics. We assume that there is 5% infected in city 1, and as they travel to other cities, they spread the virus. And you see the number of infections among the high risk and low risk people. The number of infections in high risk is much lower because they tend to stay home. I'm going to show the next slide. And then the ratio of death is much higher among the high risk people because of this pandemic. And in our scenarios, about 8% of the high risk people will die because of this virus. So what is important here is the mobility dynamics. As you can see in the graph on the left-hand side, the low-risk people from city 2, when they are traveling to different cities or choosing to stay home, the pandemic has almost no impact on their decisions because they have a very low rate of dying and their risk is minimal. And if you look at the high-risk people, the blue line shows the probability of staying home. And as you can see, before and after the pandemics, there is about 18% of the people staying home. But since they are faced so big risk during the pandemics, they all stay home, and it reaches to 100%. So here is the first scenario. What will happen if we isolate city 1? And on the left and right hand side, you see the number of infected and the death rates. The green line is the city 3, which is affected from the initial infection at city 1, which is the purple line. As you can see, the city 2 gets the infection a bit later than city 1 as the people from city 1 visit city 3. And then if you isolate city 1, actually what you get is a much later infection. We assume that the isolation is about 20 weeks. So what happens when you get the infection much later and much milder? As you can see, the number of infected is around 6% as opposed to 16% in the solid line, which shows the intervention scenario where we are isolating city 1 and not letting anybody to go out or get into city 1. So essentially, since the infection rate is much lower, there is no congestion in the healthcare system, and the number of deaths decreased significantly in the right-hand side graph due to the isolation in city 1. So city 3 benefits significantly from the isolation in city 1. However, when city 1 does that, you can see that the death rate increases slightly, about 1% in city 1, because when they stay in their own city, they cannot really travel, so the probability that they infect a local person is higher. And all the other cities benefit. And you see a similar scenario for when you calculate the output. So city 1 has no incentive in terms of health benefits or economic outcome to isolate itself. Okay, so the similar story here. You can see the average. I'm going to skip this for the sake of time. And an alternative scenario to this, okay, so we established that city 1 will not isolate itself because they have no incentive. What if isolate all cities? So if you isolate all cities, because even if city 1 does not want to isolate itself, city 2 and 3 can isolate themselves, which is effectively isolating city 1. You will see that in the yellow bar versus the red bar, the outcome for city number 2 and 3 is almost the same as isolation of city 1. So if city 1 does not isolate itself, city 2 and 3 will isolate. And the outcome for the health outcome for city 2 and 3 will be almost identical. However, the economic outcome, as you can see in the graph in the right-hand side, is much worse in the yellow bars. So there's a huge economic cost for shutting down the entire country. It was much more efficient for the country to shut down city 1, which would never happen if city 1 could choose, because they have no incentive. So as you can see, the policy in city 1, although it is negative for them, has a positive consequence for the other. There's a spillover. So you actually need to have a policy coordination in this scenario so that you can isolate city 1 and compensate them possibly for their economic loss. And as you can see, the loss in terms of the number of deaths is just the same. So they are not negatively affected from this compared to full isolation. Okay, so we have another scenario. I don't think I
should
have
probably
time.
ask you to jump ahead and see if you can wrap up because we're out of time.
Yes. Okay, so thank you. So just wrapping up, so I did not have time to show the last policy scenario. So we show that labor mobility affects the spread of outbreak and vice versa, and there are strong externalities across individual decisions as well as local policies. And you need policy coordination at federal and global level. This is really essential. And we are going to calibrate the model with using real data in the future work. Thank you very much.
Wonderful. Thanks very much, Erhan, for this presentation. What we'll do now is open the floor, the virtual floor, I guess, to questions from our audience. If you're on WebEx, if you just send me Art Cray a chat, I'll know that you'd like to come in, and I can acknowledge you and give you a chance to speak. And if you're on YouTube, just send a chat, which will find its way to me, and I'll just read out your question for you because that channel is one way. While people are getting their questions queued up and thinking about them, I'd like to start by asking one, quite general question to Mushfiq, based on something that you said at the very beginning of your presentation. So you started by saying that, well, Bangladesh isn't going to have the luxury of access to tests, to widespread testing, and as a result, there's a whole bunch of other things that you can do with other types of data, and also recognizing the fact that testing is in some ways limited, because even if you know who to isolate, it's very hard to force isolation on people when people are hungry. So my sort of general question is, do you have a sense from all these different tools at your disposal how far away from the ideal we were? So if we could costlessly drop 1 billion tests into Bangladesh, how much better would public policy be compared to creative use of existing data? Because I think this is sort of a real trade-off when the Bangladeshi government has to think about how much they want to invest in acquiring tests and how much the international community needs to think about the incentives that they need to create to produce tests at scale.
So that's a deep question. It's also a really, really tough question. So let me just give you uh, some incomplete answers and thoughts. Right? So one way to think about this is that this in low middle income countries, this has become as much an economic crisis as it is a public health crisis, right? And therefore, it's even if you were to have the luxury of all the tests in the world, right? It's still important for us to track what's happening on the economic side, what's happening to food security, what's happening to employment, etc. Right? So I think it's not a either or question at all, right? It's like even if you had all the tests, you'd like to conduct other types of surveys, collect other types of records, right? That have predictive value, but also like other things that have descriptive value of just tracking what's happening where. Right? I think that needs to be done anyway, right? So in some sense, there is no trade-off. It's just you even if you have tests, you have to do both. And so our approach has been since we're having to do the economic side anyway, might as well use the same format and use the economies of scale to collect some public health data as well.
Thanks, Mushfiq. I'm just going to read out one question that has come through from the YouTube channel from Sharif Sala, and this is a question that's directed to Erhan. And the question is, for the mobility model, what was the underlying assumption on the starting percentage or the probability of infected people? Didn't quite seem clear in the presentation, and while I'm elaborating now on the question that's asked, it does seem clear that this would have significant implications for the dynamics that you see afterwards. Go ahead, Erhan.
We assume that the initial ratio of infected people in city 1 is equal to 5%. And then there's a mobility rate of 5% approximately to each city from this city initially without the pandemics. But of course, with the start of pandemics, there's a higher chance that you will visit the other city because that's the infection rate is lower in other cities. So it is endogenously spreading to other cities. And then the infection rate is 0.9, the marginal infection rate. So that is, if 100% of the population was infected, what will be the probability that you pass it to another person? That's usually the I think it was the beta parameter in the SRI models. So it is 0.9, but it is weekly. It's not daily. And then also when you stay home, it reduces to 0.3. And then it is correct that it has a significant impact.
Thanks very much, Erhan. Let me say again that the floor is open to questions. I haven't seen anybody ping me through the chat function asking to speak up, but I'll just be quiet for a moment and allow anybody who would like to jump in just to speak up, since we don't seem to have a crowd in the queue. So the floor is open for those WebEx participants who would like to ask a question. Yeah, so there, just one follow-up question that just came into the previous question to you, Erhan, which is, what are do these findings not imply that global policies would need to be coordinated, especially regarding global travel? I think, or to elaborate, because it came in a very brief form through the chat, is it important for your model that the 3 cities are located in the same country? Or can we think about a national boundary between them and what those implications might be?
So thanks. So it's an excellent question. So we did not have enough time, so I had to skip those very quickly. But basically, the way we think about the problem is at the local level, the individuals interact with each other to visit a different shop, right, or a different business. So they spread the virus like this. And then if you can generalize the same idea, because there's an externality at the individual interaction level locally, but there is also an interaction and externality at the city level, where people travel to different cities. And you can even generalize this further, that people are traveling internationally for business or other reasons. And then you actually need to have coordination at the global level. So you need coordination at the local level across individuals, at the federal level across states, and at the global level across countries. Because it's like a Nash equilibrium, where, like a prisoner's dilemma, essentially.
Thanks very much, Erhan. I think we'll sort of do last call for questions, and then maybe I'll just go back to the two speakers to give them an opportunity of 2 minutes for parting words. But just pause for a moment in case anybody would like to jump in with a question. Just unmute yourself and speak up. All right. Then in that case, let me just go back to Mushfiq, if you'd like to share a few sort of closing observations, either stuff I cut you off that you couldn't finish in your presentation, or if you'd like to react also to Erhan's presentation, and then we'll go to Erhan for the converse.
Okay. Yeah. I mean, first, let me just quickly say, Erhan, really great work, and like integrating thinking on migration, thinking on economic behavior with thinking on viral transmission is really critical. So I'm really glad you're doing this work, and let's be in touch by email, and I look forward to learning more. And then maybe we should also talk about like how one might integrate microdata within countries, or even across countries on migration, in order to parameterize these models well. So let's be in touch. And for the rest of the audience, I just want to say that I went through a lot of different things very, very quickly. So one of the things I showed you was these subnational maps of COVID risk exposure. So pretty much any country that has LSMS surveys at a minimum we can do this exercise for. So if there are countries that you are working on where that might be of interest, we'd be happy to collaborate and connect. So please let us know. And the Bangladesh government is finding that type of exercise useful, or at least some factions within government that I interact with, and perhaps other governments will find that useful as well.
Thanks very much, Mushfiq. Erhan.
Thank you very much. So thanks a lot, and it was an honor to present after Mushfiq. It's a great comprehensive work, and we were just focusing mostly on one component, and we can benefit a lot, hopefully, from his paper and his findings. So I already received a few comments privately from Michelle and others. I'm going to respond them via email. And it is, of course, a very preliminary work, joint with Çağlar and He. And any comments or suggestions, feedback would be appreciated. And I think Ryan was going to distribute the slides, so you can find our email addresses in the last page. It is my email, Çağlar's email, and his email. So in the order of the last names. And please, if you have really tough question, direct it to the the third email, which is his email. And if you have an easy question, just send it to me. And thank you very much.
All right. Well, thank you very much to everyone for joining us, and especially thank you to Mushfiq and to Erhan for these very stimulating presentations. And we'll look forward to seeing many of you on WebEx the next time around at our next e-seminar on COVID-19. So thank you again for joining, and stay safe, everyone.